So you're all very welcome to our webinar today, Being Literacy Friendly with Pavee Point Traveller and Roma Centre. We're really glad you could take the time today. We're going to keep this webinar to an hour, and we've got a good crowd, so hopefully there'll be quite a number join us. If you could remain on mute just so that we've no background noise while the speakers are speaking, and you're welcome to use the chat box for any questions or comments throughout. So you'll see we've already been sharing what parts of the country people are logging on from and the different organisations, and we've got a great diverse group today, so a great opportunity to learn from all the experience of Pavee Point Traveller and Roma Centre. So just before we get started, just wanted to mention ourselves and the National Adult Literacy Agency, NALA, what we do. So our two main things that we do are we support adults to improve their reading, writing, everyday maths and digital literacy. And we support organisations to use and promote a literacy friendly approach. And that's what today is about, how we as organisations in the community and voluntary sector can be more literacy friendly to include more people and make sure everyone has access to our services. So the plan for today is that I'm just going to do a very quick intro into what the literacy friendly approach is. Then I'm going to hand over to Mary-Brigid Collins, the primary healthcare project coordinator, and Mary Collins, the primary healthcare worker in Pavee Point. And they're going to talk through their experience of providing support and information and raising awareness, particularly around health through literacy friendly ways. Then we're just going to give space to see how you yourselves are using already a literacy friendly approach, or how you can improve and become more literacy friendly in your work. At the end, we'll share all the resources afterwards, so the slides, any of the links, and then we'd also welcome your feedback through a feedback form. So we're starting off just to talk about this taking a literacy friendly approach, just so we all know kind of where we are on the same page. And just before I get into that, I just wanted to mention the Adult Literacy for Life strategy. Now, for some of you, this will be really well known, so apologies for the repetition, but just wanted to make sure that everyone does know about the strategy. This was a government strategy that was launched in 2021 by Minister for Further and Higher Education, Simon Harris. And it's something that NALA and many other organisations would have advocated for a long time, to have this whole government, whole society approach to literacy. As we always like to say, literacy is everybody's business. So it's really important that the entire government, all the departments, everybody is on working towards the same goal in regards to literacy. And within the strategy, there was 12 groups named as people who have experienced educational disadvantage and various inequalities, and that may mean they just need targeted support in terms of providing literacy friendly services, but also accessible opportunities to develop literacy if they want to. So just wanted to name that strategy. The link will be in the slides afterwards. So just to kind of start off with the definition of literacy, just so we're all on the same page about this, literacy really has a broad definition. So yes, it is reading, what many of us would associate with literacy, but it's really about understanding and being able to take action then. So you're comfortable reading something, understand it and take action on, the information that you've received. It's about listening and speaking, those communication skills, being able and comfortable to ask questions, analyze information that you hear, and again, being able to take action. Writing and spelling is part of literacy. And then in NALA, we also look at numeracy. So that's those kind of everyday maths tasks, like working out a discount in a shop, splitting a bill in a restaurant with friends, working out, the rates of electricity, with all these bills and the rise in inflation. There's a lot of tasks, everyday tasks that we use our numeracy skills for, and it can be quite an overwhelming piece. And then digital literacy is something that, of course, has become increasingly important. We are seeing a lot of things. Myself and the Mary-Brigid and Mary were speaking about how so many public services have gone online because of COVID, and this can be quite exclusionary, not only because people may be not confident using digital technology or phones or smart phones, but they mightn't actually have access to Wi-Fi, or so there's a lot of expense associated with digital technology. So it's both in terms of the literacy element and also the access. And underlying everything when it comes to literacy, in our experience, is confidence and self-esteem, and how people feel when they're in situations, it's particularly about health, which you'll be hearing a lot today, or any kind of stressful situation. Your literacy can change depending on what's going on for you. And if you're very stressed out and very nervous, it can really affect how you understand information, and I suppose that deep power dynamic that is often there when people are communicating with professionals. So people that they perceive maybe as having more power than them or more education to them. It can really be a challenging scenario if you've unmet literacy needs as an adult. And one thing that we really emphasize in NALA is the wealth model. Every adult has a huge amount of experience, knowledge, and skills, regardless of their literacy. So it's really important that we recognize that. And there's a great saying that a beginner reader is not a beginner thinker. And it's just really important that we all acknowledge and recognize that every adult has a wealth of skills and experience, regardless of literacy. So just something to be mindful of. And something we, really want to emphasize today is the connection between literacy and inequality. So literacy is not a neutral thing. It's really bound up with power and access to different things. So very much linked to educational disadvantage. And there is a widening gap, we know, in Ireland between people who have resources to live a high quality, a high standard of living, and those that don't. So we know that those who have their literacy needs met by the time they kind of leave school, if they're lucky enough to get on okay in school, they're confident in their literacy skills, and then they continue to have access to education, training opportunities throughout their lives, and they often get access to more and more and more education, where often the people that need the support the most, once they have been left out at an earlier age, they continue to be excluded from training and education opportunities. So this is known as the Matthew effect. And it's really important that we acknowledge that if an adult has unmet literacy needs, it is a systemic issue. It is not an individual issue. So we say this because it's important that people understand it is not a personal failure or a personal individual's fault by any means. It is because at some point in their lives, there was a lack of support, exclusion from certain things. And as today, we know racism had a huge impact on education amongst the traveller community and the Roma community. So it's just really important that we acknowledge that it's a systemic issue, not an individual issue. And this is why it's so important that community and voluntary organisations like ourselves are making those steps to be literacy friendly, acknowledging that people deserve to be included after many years, decades of exclusion. A quote I've used before, but I really do love it, is literacy means liberation. This is from Septima Clark, who was an educator and a political organizer in the civil rights movement in the United States. And she was really determined to ensure that older Black people were able to participate in the movement. So for her, it was really that literacy was key to gaining that political, economic, and social power and undoing all of the painful history experienced by Black people in the United States. And again, this is just acknowledging that really strong link with the inequality. So the literacy-friendly approach means really being aware of the unmet literacy, language, numeracy, and digital literacy needs. So being aware of them, keeping your eyes open, being sensitive to them. Then it's about the next step there would be taking account of these and removing literacy related barriers. So it's one thing to be aware and to have a greater understanding, and then it's about taking action. And And we also really urge people when they learn more about these things to promote it elsewhere. So within your, work, if you, to the extent that you can, and then also outside, because a lot of us will deal with public services, other organizations, and it's really, important that we're raising the fact that there may be people with unmet literacy needs who want to use your service, but you've got a couple of barriers that you need to address. So it's really about how we can make the change in our own work and then continue to promote that change elsewhere. And so I suppose the reason why you would do this, take a literacy friendly approach in general, is you really don't know who understands information or services and who does not. So if you're meeting people once off and they're coming to you, you're not really sure who may have unmet literacy needs and who may not. Like I mentioned before, literacy is situational. So if we are dealing with a serious health issue, it's going to affect our literacy and how we're navigating information. So all of us at one point will have our literacy affected by different situations. And look, at the end of the day, we do all benefit from clear information. There's no bad thing about having things clear and accessible. And so this is why a lot of organizations would use this universal precautions approach, the idea that we treat everybody that comes to us at risk of not knowing or understanding information. So we don't leave things out. We provide the full information and all the accessible ways that they can receive it. So just very quickly, our literacy friendly standards that we developed in NALA, there are 10 of them, and they're under four headings. So the first one is communications. Then we have staff awareness and responding sensitively. Then there's policy and procedures, and then we have an evaluating and improving. Communications obviously very key. The way we speak to people, the way we provide information in written format or in alternative formats, that we check that people understand what's been said to them or what they might have to do next. And the next section then kind of informs this, so that staff are aware. You're going to webinars like this, you're doing different training, so that everybody's aware that they might meet people who have unmet needs, and how might they adapt the approach within the organization to ensure people are getting the information they need. So we'll send these on after. I just wanted to touch on them to give you an idea of some of the recommendations for making your work more literacy friendly. Some of you may have heard of plain English before. This is something NAL has been working on for a long time. Plain English is a style of presenting information that helps someone understand it the first time they read or hear it. And it's around language, the type of words you're using, making sure it's the words that your audience knows and is comfortable with, everyday words, how you lay it out, the structure and the design. And it's always about going back to not what you want to tell your audience, but what your audience need to hear, what's the most important information for them. And that should guide how you present information when you're writing things and when you're speaking. And I'll share resources around plain English with you later on. So again, the main reason we want to make changes to be literacy friendly, including using plain English, is better access. We want people to be able to access our services. We also want there to be a better understanding, so that people walk away knowing what they have to do or how to take the next step, so that there's maybe fewer mistakes and fewer questions. People don't have to repeatedly ask you, because they feel comfortable and confident the first time they've received that information about what they have to do. And yes, of course, it saves time and money for more people to be helped. So I know that was very fast, but I just wanted to give you a little bit of context before I hand over, because Mary-Brigid and Mary really have they're exceptional in their experience in Pavee Point, both in terms of how they do their work, as in taking a literacy friendly approach, but as well the breadth of the work they've done over decades in around health literacy and promotion. And they did actually win an award, a Plain English award from NALA around their Pavee Mothers project. So award-winning work, so extremely useful to you all here for, I suppose, looking at your own organization and maybe taking on some of their experiences and seeing how you could apply that. So I will hand over to you, Mary-Brigid and Mary.
Yep, that's grand, thank you. Everybody can hear, yeah?
Yeah.
Okay, just get our PowerPoint up there, yeah. So good morning, everybody. My name is Mary-Brigid Collins. I'm the coordinator of the Primary Healthcare Project in Pavee Point.
Good morning. My name is Mary Collins and I'm a primary healthcare worker. In Pavee Point.
Where's the arrow button? Can't see it. This one here, yeah?
Yeah.
Yeah, so just going to go into a little bit, maybe just about Pavee Point for people who doesn't know anything about Pavee Point. But I'm sure a lot of people probably did hear about Pavee Point in the past. And just the Pavee Point started up in 1985 and has been going ever since. And it's a mixture of settled people and travellers. Mixture of settled people and travellers and Roma working together to achieve human rights for travellers and Roma within Ireland. We do a lot of policy work in Pavee Point as well, and also we do a lot of representation work out in different countries and committees and stuff like that, making sure that travellers and Roma is on the agenda, let it be men, women or children, and it could be around education, accommodation and other issues that travellers are facing within Ireland. Within Pavee Point, we do have a number of different programmes there, and as I said, myself and Mary is from the Primary Healthcare Project there. But we also have a men's health programme, and we have the violence against women, and we have the education, the drugs, and we have a Roma project as well. And also we have, the education programmes. So we do have a number of programmes within Pavee Point other than the Primary Healthcare Project. But at the same time, as different programmes, we all link together at doing different resources and because lots of these issues on the ground around men, violence against women, drugs, they're all issues that travellers are facing within Irish society as well as the general population. So given that we have a number of different programmes, it's very important that we all link together and work together. And we have done so in the past around different leaflets and different resources there as well. So that's very important there around Pavee Point.
So as a primary healthcare worker, I'd be doing crosswork with the rest of the programmes. So say with information out on the ground, that's where my work will come in, because with the literacy friendly, as you said, that's the way we bring out the information for people as well to understand the work and what's getting done.
Just a little bit around maybe travellers' health as well. In 2008, we were funded by the Department of Health to do an All-Ireland health study, and we published the findings in 2010. But as I said, this study wasn't going to end overnight. We were waiting a number of years before we actually finally got the money to do this All-Ireland health study. But the importance of the All-Ireland health study, it was done by travellers, for travellers. Again, there was literacy problems within some of the primary healthcare projects, and where there wasn't primary healthcare projects, there was local traveller organisations. So we had over 340 peer researchers trained in how to go out and collect information. Again, we had a voiceover, we had symbols, and it was colour coded. So the message that comes out from this All-Ireland health study, which I'm really very proud to say that lots of us has been involved, is don't ever think that you cannot research your own community because you have literacy problems. There's lots of different ways that you can actually go out and research your own community, and we done that from the All-Ireland health study. So just to give you an example of some of the results of the All-Ireland health study there, as you see, travellers die much, much younger than the general population. We know that it's 15 years less for women. The suicide rates, again, 11 times higher, count for all 11% of deaths within our community as well. Infant mortality rates as well, it was high at that time as well. And one of five travellers had a disability. And then over 53% was worried about experienced unfair treatment when they went to use the health service. So if you look on the other side there, you look at the two pyramids there and you see the general population and you see the traveller one. And the general population, like you see, they're living well into their 80s and 90s. And we do know that from government planning for the last number of weeks that they are actually planning for people that's coming out living longer. And we see the little bit of the summary of the results there of the census on the news there 1 or 2 days ago, that we have an aging population. But I think if you look at the traveller community, and we do know from the results of the study, out of 40,000 travellers, we only got 8 travellers over the age of 85 years of age. So I think when it comes to planning, they certainly wouldn't be planning for travellers, because we know life expectancy for travellers is only about 64 years of age, which that's quite young for travellers to be dying. So these are the results of the All Ireland Health Study. We do have a very young population, and we feel that if things doesn't change for the young population around the social determinants, around education, accommodation, the youth discrimination and racism that travellers face within Irish society, we have over 80% of travellers are unemployed at the minute. So we do have a lot of issues within our own community, and we all know how the social determinants impacts on people's health, but also on the mental health as well. So that's just a very small summary there of the All Ireland Health Study. It was a huge study, and it was called Our GILS, which means ourselves. So it was done by travellers for travellers as well. So that was a very important piece of work as well that we done out the ground there. Just these are some of the key findings here. Around the literacy there, around education again. And we all talk about education and the importance of education, and we know it gets you a lot of places as well. And it's so important to have it, so you'll be able to do what you have to do and fill in forms and stuff like that as well. But in the All Ireland Health Study, only 35-year-olds to 45-year-olds had only primary school education. So that would be my age group. And then when we asked travellers, did they have difficulty in reading? Over 29% of travellers said that they have difficulty in reading. But when we asked them, could they read a medication, it was over 50%. So lots of travellers are very much embarrassed to say that they can't read. And again, only 1%, less than 1% of travellers go on to complete 3rd level education. We know travellers drop out of school at a very early age. Within secondary school, it could be 1st or 2nd year when they drop out of school as well. So there's a lot of issues around education, and we do see travellers coming to school with very little or no education. And I think it kind of asks us question like what's happening or what's going on. And sometimes within our work, we have an education program here as well. And sometimes it's been educated, but also sometimes maybe teachers have very low expectations of travellers. Oh, but they won't get jobs. They don't want to work. Of course we want to work. We do want to get jobs. We want a good education. We want a good accommodation. And if we don't have good education, if we don't, then that stops us from getting good jobs. Then again, the discrimination and racism the travellers face as well. So they all have a link together there. But also the huge concern as well that we would have around, and we did see during COVID as well, where a lot of stuff actually went online. And you're already looking at a group of people that face huge health inequalities within Irish society. And when stuff went online, we didn't know many travellers access stuff online. And I know when I hear the word online, it's a turn off for me. Like even if there's no face-to-face service, that has an impact on people as well. Because I know in some services there's no face-to-face to give you a form to fill out without realising that people might be able to fill in the form. They might need a bit of support. So I think service providers, I think, have to sit down and think of people that's using the services. Even if there's a service getting set up, how does it meet the needs of people? Because you might have people that go in that probably wouldn't have English. You have people that probably mightn't have English, but also mightn't have literacy skills as well. And I think people need to be at the table that these services is actually getting set up for. Just for example, if you take the retina screening, there's 4 national screening services. And if you go into the retina screening, there's an alphabet brought out straight away to see, can you read the numbers? And I know when I had an extended family member in there, it's not that they couldn't see it. They didn't want an A and a B, C was because they didn't get any schooling. They never went to school. They're taken out at a very early age, and like they were in their 70s. But then you know the people coming in that you had to fill in a huge application form before you got your eye test done. But it was all the medical terms that was on it that people just couldn't understand. and there was a settled man in front of me, and he said, "Oh," he said, "I forgot my glasses." But I was kind of thinking in the back of my head, well, maybe he's like myself. He can't read it and he doesn't understand it. But the services didn't support him. So I think we really need to be sitting down together when services actually being set up as well. And I think that stops a lot of people as well from using services. And we do encourage people within our primary healthcare project to go and to use the services. But if you're facing these issues, is actually a turn off there. So that's just kind of as you can see there, over 55% of travellers have completed their formal education by the age of 15. So there's a very young dropout within schools as well. And then lots of them like to live at home, and the mother father mightn't have any formal education at all. So this kind of impacts on their life and their daily things that they want to do as well when around education. Our approach is the community development approach, working in the community, listen to what people have to say, but also we have a very good relationship and we have the trust out there within our own community as well. So that's very important for the work of the primary healthcare project. And we always had that and had that for a number of years. And we've seen it within the All Ireland Health Study, when we got an 80% participation of travellers taking part in the study as well. And then we always work around the social determinants, and lots of studies now that's getting done, looking at the social terms, how it impacts on people's health, but also on the mental health. If you look at accommodation issue and the homeless crisis that we have at the minute, and people living in hotels, in the future, that's going to create an awful lot of problems. You have people who can't cook meals. Obesity is going to be a problem with young children, the homework, not being able to do the homework. So it's a much, much bigger picture than the racism and discrimination that certain groups of people face within Irish, led by men, women, travellers, different groups of people out there, and then the educational levels as well. So we always work around the social determinants of health, which is important for our work there. And we do know that an awful lot of travellers live in very bad accommodation out there, and there's near enough over 40% of travellers are homeless at the minute. So like that could be doubling up in bays, could be sharing taps, maybe one tap between 3 or 4 families, maybe a family living in a trailer, which is a very small size trailer. So accommodation has always been a huge problem out there with travellers. And again, during COVID, this we even highlighted even more, where you had to social distance, you had to wash your hands. But a lot of travellers out there, and the primary healthcare project visited them, they knew they had to do it and they wanted to do it, but at the same time, it was very, very difficult for people to do it, like it was for a lot of people. But it really highlighted the accommodation issues the travellers had out there during COVID and even before COVID as well. So Mary is just going to talk about some of our different resources there that we've done within our primary healthcare project.
So for example, we have the Pavee Mothers booklets. So this is the one we won the award for. So say bringing the booklet out to the young mothers, say from the beginning, like our work, I'll be on the ground working with the young mothers. We'd ask them the questions like when they would go to the hospitals, what experiences they would have, say in the hospitals, or say coming home and looking after themselves during pregnancy, and what to do, let it be healthy eating or properly making bottles or sterilizing. So everything is in the little book, or even encouraging, say, for them to breastfeed. So with the booklet, like he says, that's literacy friendly, that they can look at when they go into the hospitals, they come home not really knowing a lot. So with us speaking to them on the ground and building that trust and knowing them, say some of them probably only starting off having their first babies, how important it is to attend their antenatal and looking after themselves, and even after when their baby is born. It was very easily a little booklet for them to look at. So say they might have 2 children, they might have 3 children. So say even as myself, they get married very young and have their babies very young. Say myself, they had 4 children. Say the information in the booklet, or say talking to women on the ground, their experience and stuff that I wouldn't even have done myself. Because even say, no one ever asked me, did I ever even consider to breastfeed? So it was very, very good a book now for them to out there. So as soon as we go out doing our field work and out on the ground, we know, say, find out somebody is just, they having the first baby or due their second baby, we do pass the book and the information. So it's very easy to look at for them as well, to learn more.
Yeah, and also this information for the breastfeeding book would have been took from the My Child book, which the HSC published there. and it was a huge book. There was a lot of reading in it and a couple of pictures in it. And what we found is with young mothers there, they had difficulty reading it. So if they couldn't read it, they weren't getting the information, which was quite important information that they needed. So what we done was we took pieces of information from it and simplified it in a very easy way so travellers could understand and get the message around breastfeeding, because we do know breastfeeding was the only thing that traveller women done years and years ago, and we know there's very few travellers actually breastfeeding at the minute. So we do encourage people to breastfeed, but also what stops a lot of mothers from breastfeeding as well is when they go in to have the baby, to put on a special milk for lactosemia, and that doesn't come back within 24 hours. But at the same time, mothers needs to be encouraged within them 24 hours that they can pump milk and they can breastfeed, but also that they can breastfeed and bottle feed at the same time as well. So sometimes people wouldn't have that information. We do have a little video here. I'm just going to show you a little clip of the video as well that we've done around breastfeeding as well. Yeah, so that's just a very short video that we done to support the booklet that we done around the breastfeeding and the importance of breastfeeding, but also traveller women that's in it as well to promote breastfeeding within our own community. And also we have a Pavee Mothers program in here on Pavee Point as well, and they would do a lot of things around maternal health and working with some of the maternal services out there. And there, a couple of months ago, we done our Pavee Mothers website. And again, this is a very important piece of work as well, because it has a voiceover. And it's very important that we get the information out there to young mothers. So it's out there for young mothers who can use the phones, but also if they don't want to go on the website, that there's other different ways of getting the information. So we do have the Pavee Point Mothers website there. As I said, there's a voiceover again. It goes into different bits of information within the website, and just click on them, and you can click on the icon there, and then you can hear what your information is. And I think we're just going to take an example from it and just show you very quick just the kind of things that does be on it there. And again, a lot of work went into this as well, and was done by travellers for travellers as well. Yeah, so that's our Pavee Point Pavee Mothers website there. And again, there's a lot of information on it. You just click into what information that you're actually looking for there. So that's working really well at the minute, because a lot of the young mothers did take time and look at it there, and has used it as well in around just before they give labour, just as soon as they hear that they're pregnant, so they get their information there. So that's a very good website there. And again, a lot of work went into that as well. And it was a national piece. Some of our work will be national as well, where other primary healthcare projects will come together and give their input as well, because that's very important, because this could be used right around the whole country with primary healthcare projects, but not only with primary healthcare projects, but other people as well that might have literacy problems, but might be looking for the information, but find it's difficult to get the information there. Because we do know from the work that we do on the ground as well, and particularly for some of the maternal services and we had a girl working in here who was having a baby, and she was attending one. Sorry? Yeah, so we had one of the young girls here that was using one of the maternal services, and when she went to use it, she was actually given a big book, and it was over 300 pages. So she said, I just couldn't read it. She says, it was too big, there was too much information, and I didn't understand it. So she didn't understand it, couldn't read it. She wasn't getting the information, which was very important to us. So we actually took that book and we simplified it down again, and we done our own smaller version of it again, and we gave it out to pregnant mothers on the ground as well. So we do a lot of that stuff within our primary healthcare project. And again, our breast cancer awareness leaflet, and we did win an award finale around this one as well. And then, as well as doing the leaflet, which was the bigger size one, kind of how to check yourself for lumps and stuff. We've done the purse size one as well. So there was a purse size one that you can actually bring around, which was quite handy for a lot of women out there as well. And the signs, and then we work with the Mary-Brigid Foundation around that as well. So we done them leaflets, but then at the same time, it was transferred into Arabic as well. So lots of these resources that we are actually doing within our primary healthcare project does meet the needs of other people as well, that can have difficulty with their literacy and stuff like that. Do you want to talk about cancer leaflets, Mary-Brigid?
For example, we have 4 the leaflets here that we've done for the cancer. So bringing them out again to explain to people, it's very friendly and there's lots of pictures to explain how to look after themselves. So with women, so that we're out there trying to encourage the breast, like check their breasts and to have their smear test. It's a very friendly, easy way to explain to them and let them know what's going to happen. And even for the men, which the men, it'd be probably a little bit harder to talk to about certain things. So just even having like a friendly chat with them and leaving the leaflet with them, it's very handy for to do as well, and for the bowel cancer.
Yeah.
For men and women.
Yeah, and we do know there is 4 national screening services as well. And we do know in our community a couple of men for the last number of years has been diagnosed and has prostate cancer. So it's very important that we get the information out there, because we know men in general are not very good looking after the health. But I think when you come from a community such as small as ours, and you do face huge discrimination, racism, and it's difficult getting into the health services, or you feel that you're not being treated fairly, it does stop you actually from using them. So just around the bowel screening as well, we link with the bowel screening service there, and there is a national program there, and you do get a kit posted out to you and how to use the kit. But sometimes travellers mightn't have doesn't have the literacy out there. So what we done was we linked with the bowel screening services, and they came into us, and we done a bit of training of the kit that you will get out, how to use the kit, what to do with the kit, what you should write on the kit when you're actually posting it back in. And we got the training, and then we delivered that then out to the people on the ground, that at a certain age, you're going to be called for this bowel screening. And when you get this screening, this usually what happens, and this is what you have to do. But also what happened out there, sometimes you do get the results in a post. And sometimes in some of the traveller sites, they're actually not getting post. So what we had to do was we had to give Pavee Point's address. So we would get the letters in then and bring them out to people then and let them open them and see the results then of the bowel screening testing that we get. So this was a very important piece of work, and we're still working around the cervical check, and we've worked with the breast check as well to make sure that travelling men and women out there are registered for these services as well. So there's about the group going out, getting people's PPS numbers, getting their names, getting their dates of birth, and giving it into these services to make sure that travellers will be registered. So that was a very important piece of work as well. And again, we've done a couple of videos to match these posters as well, these leaflets as well. So we do work with a lot of organisations. We work with the Asthma Society, the Alzheimer's Society, and as I said, the Mary-Brigid Foundation, the Irish Heart Foundation, and I'm sure there's many others which I just can't think of at the moment, but we do work with a lot of services. And what's important as well about these is some of them actually come looking for us to work with them, because at the end of the day, they know there's not very many travellers might be availing of the services, and what can we do to improve the service as well. So we do a lot of work around that as well. I'm not too sure now if there's any questions, but just a PowerPoint and the work that we do within Pavee Point. I hope you got a lot from it. So we're open to questions if you have any questions.
Thanks a million. That was really brilliant. A lot of information there, and loads of examples of changing things to be more literacy friendly that I think people can take onto their work. If anybody has any questions, you're welcome to go on the mic or pop in the chat. What I might do beforehand, there was just a little bit of noise when you played the video, so I might play the video again just to give people another chance to listen.
Yeah, do, yeah, that's no problem, yeah.
Now, so if you want to have a think about questions while I do that. Anybody else?
All like this.
Can you see that now?
All travelling women have them as well as me. And you get your baby.
A couple of questions here. The first one was just a question in general about education. Isha asked, is the education rate now increasing? Are more people staying in school longer?
Well, we do know we have an education program here, and they're doing a lot of work with the Department of Education as well around an education strategy for travellers. We would like to see a bigger, much improvement, and I think it has improved, because I think we as a younger generation were more involved in schools and making sure that we ask questions and that we go over the parent-teacher meetings as well. So we're very much involved in the education of our children as well. So we would like, that's just the results from the All-Ireland Health Study, but we do know from the work that we're doing on the ground that there's still children coming out at a very, very early age. We do know there's very high rates of unemployment within the traveller community as well. And we do know from talking to some of the children, I know I had great difficulty myself with a 17-year-old son that I had at school at the time. And he was saying, well, sure, look at mommy, if I get an education, where am I going to get a job? Then as a mother, you're saying, well, look at education, not just about getting a job. Of course, we know it might be difficult getting a job, but at the same time, education is so powerful that if you ever go into a service, that you can get an application form and you can fill it in. So I think it has changed over a number of years as a younger generation coming up, and we do see the importance, but we do need to see changes within the education system as well. And I know when I went to school, and I would have been one of the ones that would have been 35-year-old to 45-year-olds, like I'm over 50 now, and my education levels would be quite low. But at that time, we were the only people in the school that was different, was only about maybe a good couple of travellers. We didn't like have schools what we have now. So you have so many different nationalities. We were never taught about travellers. We never spoke about travellers. We wouldn't teach the importance about it. Only the more you hide your identity, the better you felt. So therefore, it impacted greatly on your education. But also at the same time, a lot of them schools would have been run by the Catholic Church, but now that we don't see much at all. But we would like to see change, and we should see change when it comes to the education levels as well. And it's not just for travellers, it's people in disadvantaged areas as well, where there's huge high rates of unemployment. People face huge discrimination because of where they live and the address that they give. So I think we all can work in solidarity as well and to improve these things, because we all experience one thing.
And my youngest son, Michael, came out of primary school and he couldn't even read. So how did that happen? Like, he could come out of primary school, not even being able to read. He went to secondary school, and when he did go to secondary school, the teachers took a very good interest in him and they helped him very much. And when Michael done all of his secondary school, the teacher was very good, and she got him a little course in Whitehall in community development, and he done that. And when he did, he went down to get a CE in Exchange House, and from there it was the help that got him to know how to put in for the Susie grants and to attend college. So he'd done his 3 year in college, and today he's working, he's well educated now. But I do think for traveller children in schools, secondary schools, no matter where they go, they need that little bit of extra support.
Definitely.
Because some of them is coming out of secondary school saying there's nothing for me. Then they realise when they're too late to go looking for work, they haven't got the qualifications to get their jobs. So I do really think, let it be boys or girls, it starts from the very beginning, as soon as they start school. And if we think of the traveller population, we're only 1% of the Irish population. It wouldn't take very much, say, from the government to put things in to help us, to get that little bit further. Now, there is a few that gets plenty of help and it does go that little bit further, but there is so many now coming back out, they're not even waiting for their leaving. So the future, I think, in education does really need more help from the very beginning.
Yeah. And I think what you pointed both of you there is that systemic issue. You know, when it comes to racism, the damage, it'll take a long time for that to, there's a lot of need for the government to step up. And we just had like lots of lovely comments, and I'll forward them on to you later, because there's lovely, everyone really appreciates the presentation. We had another question here. Do you work closely with midwives and public health nurses?
Oh yeah, we do. Yeah, our primary healthcare project. This is where the Pavee Mothers Programme come in as well. We've worked with a lot of maternal services out there, like the Rotunda Hospital and the Coombe Hospital, and has done for the last number of years as well. And we do link in with the PHNs in our local area as well. There's over 27 primary healthcare projects through the whole country. So they would always link in with their own PHN as well. And that's very important for around child development checks and stuff like that. So we do that. Yeah, we would always continue to do that and see the importance of it as well.
Sessions in Pavee Point with the midwives. So the midwives would access, say, questions for young mothers that be attending their hospitals. That some of them may be very shy, and how would you get to help them more? But I think the way it is, that some of them probably, maybe the midwives or nurses that be working in hospitals, they wouldn't know that maybe some of them young women has to go home to live in a site where it'd be very poor facilities. So, and probably some of them wouldn't have much education or literacy either. So it's a way of us learning, the midwives and the nurses, probably to help them while they're in with them. So for information they get off of us helps them as well.
Yeah, that's another question here, Susie. I don't know if you want to go on the mic as well. What would your advice be for sharing research with the traveller and Roma community? So not sure, Susie, did you mean for people being involved with research or sharing research?
No, so I'm a researcher, and
we
are doing research. We're about to do research with the traveller and Roma community, and I'm thinking about how to share findings or documentation with the traveller and Roma community. And I just wondered what kind of your advice is really around or suggestions around kind of doing that, whether it's written material or how to share it, and just any kind of advice that you give us at this kind of at early stage.
Have you done research already on the travellers in Roma? Is that?
No, we're about to. So I work for the Centre for Effective Services.
What kind of research would it be?
So we are doing an evaluation for the Centre for the Department of Education around the STAR programme.
Oh, right.
Yeah. So we have representation from
I would say
Pavee Point.
probably link. I think link in with your own traveller organisation. And I know Pavee Point has an education programme here, and I think that's probably a piece of work that would be very important to us as well. So I think your first call would be the traveller groups and traveller organisations, because we work on the ground and we do have education programmes near enough, maybe on other projects as well. So I think it would be very important to get an input from the traveller organisations as well. And I think if you're going out to research people on the ground, I think because travellers are known out on the ground and the organisations, I think maybe link it together and just see what's the best way of doing it, and just have a chat and let us know what's actually, because sometimes we find that not very many travellers on the ground might link with somebody that they don't know, because they do have the trust and the relationship built there with the primary healthcare projects. So it depends how big the piece of research is, and can maybe get more information on it. But I would say your local traveller groups or your, like the Irish Traveller Movement at Pavee Point, that would have done a lot of work around that as well. Yeah.
Great, thanks.
Thanks, Susie. We have one more question here.
Yeah.
Do you think some of the qualifications in childcare and healthcare are pitched too high, and we are losing good workers with great empathy and skills? So I think in terms of, the certs that people have to do, the level 5 or level 6.
Yeah, we know. Yeah, we do know that from the work that we're doing on the ground as well. There would be a number of young traveller girls involved in childcare, and some of them kind of will be on the community development programs, but will be working in the creches at the same time, but would kind of go up the ladder and getting their certs to work with children in the future. That has happened in some cases with them, but I think the levels is quite high. You mightn't have the literacy side of it, but you could have the knowledge side of it. So there's different ways of doing kind of, it's all written, but you might not be able to do the written piece, but you could have the knowledge of doing it in a different way or presenting it back in a different way. So we do think that needs to be looked at as well, because there's a lot of knowledge out there with travellers on the ground, also with young women that's working in creches, and also with the primary healthcare projects as well. So I think it is about looking at it, how can we do it in a different way, but still kind of get your level 4 or 5, but in a different way without a written exam as well. Yeah.
Yeah, somebody here. Oh, sorry.
More support from the schools and the colleges, because sometimes there could be something happening in a college or a school that stops somebody from learning. Because even, for example, I was telling you earlier on that Michael did do his 3 year in college, but if he did for the last year that he was doing it, a few of the students found out he was a traveller, and they really just turned their back on him. So to turn to support or somewhere like that to explain to them young people, well, he's Irish, he's traveller, like why can't you help him instead of just turning your back on him?
Yeah.
So I think more supports in schools and colleges helps a lot as well.
Yeah. And at the minute we do have about 10 or 11 travellers at the minute that's in Youth College. They're doing a youth and community development course out there as well, and they're in the final. Next year will be the final year, and there's both men and women that's out there. So I think working with colleges, the likes of Minute and other colleges there to kind of support people from disadvantaged areas and disadvantaged backgrounds, and they would have kind of literacy problems, is making sure that they're included within colleges as well, that it's not people like that has a good education from a nice area, that there is people out there willing to go to school, but there shouldn't be barriers in the way. They should be working with the communities to encourage them to take up these places as well, and then to get the supports within the colleges as well. Yeah.
Because when we go to hospitals or we go to colleges to do in-service training, you get the feedback from the young students that's going to be the future, say, of countries, and they will explain to us and tell access why is, like everybody nearly said, the students or schools where they be learning so negative to the travellers. It's always just, oh, they're travellers, just, you know, so what's going to help to stop the negativity towards them as well? Like, for to have people, even, I'm not even talking about Irish, I'm talking about people that's coming, foreign people coming from other countries that's telling us this. So why, like, you're Irish, and why is everybody in Ireland so negative? It couldn't be everybody, but they'd want to explain, us to explain why, like, when we get to know you're learning, that's not. So what's the difference?
But also what we find in our work as well, a lot of young travellers would hide their identity if they're going out looking for jobs. And I know I had this conversation about 2 weeks ago with a young girl in our area. I said, are you working? Yeah, she said, I'm working in a cafe, but they don't know who I am. I'm working on the till. But I couldn't give my address. I had to give my nanny's address because she lives in a standard housing. So at the same time, as a traveller, I can understand where they're coming from, having to hide their identity because of discrimination and racism that they do face. And if they find out that a traveller, that they're more likely to be let go for the job, or they might have an excuse saying, look at, well, we don't have any more work here. So that's a huge, huge fear. Now, I don't agree with hide your identity, but at the same time, being a traveller myself, lots of times you probably would say, well, look, you don't just have a choice, but it's a pity that we do have to hide our identity, because if you look at all the supermarkets, you go down to any supermarket, you will see a lot of different people from different countries working in different backgrounds, but you still don't see very many travellers. And if you do, you wouldn't even approach them because you have that fear in you. Well, they know I'm a traveller because I'm always in here. I might mix and talk with them, but I don't want to go over and talk to the traveller because they might not know that he or she is a traveller working in the shop. So there's a huge fear. There's a huge fear around travellers out there, and they will hide their identity. We know at the minute we've we've a few travellers within the College of Surgeons. They have graduated as GPs, but yet it hasn't come out in the media. Because there's a huge fear there that if they come out, how are they going to be treated within where they're working? And well, we know we'd have a young lad who graduated a couple of months ago in being a guard. But at the same time, he didn't want to come out, but the fear was in that if he came out, what was consequences he was actually going to face, which is a pity today in this day and age, that this is what we still experience.
Even for children that's in school going looking for work experience. Like, they can go looking everywhere for work experience. And then you have to go back to the school to help them to come to seeking to get them work experience.
Very difficult, yeah.
Yeah, and I think it's really, and thank you for sharing those examples, because I think for all of us to really understand that quite the level of racism that people experience and how that's going to, you know, affect their trust of any service, any program, anything, you know. I think that's just really important for us to constantly be aware of. And not only are we to do literacy friendly practices but be anti-racist. I mean, ultimately,
definitely, you
know, standing up when we can.
We are only like a small minority of Ireland, but people suppose looks at us all as one, when, like every community, you have, say, top class, middle class, lower class people, say, in all communities. So travellers would be the same, but yet no matter what, we're kind of just treated the same.
Somebody mentioned here just on that question about the QQI that they need to look at how they make their assessments, like you said, so that people can.
Definitely do.
There is one last question maybe before we finish up, is, are there any schools that have a specific teacher allocated to support children that are identified with having unmet literacy needs? I mean, I think in general, the schools, they would have support teachers.
In some of the schools,
So Eva, I don't,
And
you
we
know,
know in some of the schools that some of the travellers are put on a reduced timetable as well. And this is having a huge impact on their education as well. So I think that's something that we need to look at as well. So if they're on a reduced time, and then COVID, you had COVID as well, where lots of children wasn't in school, and we'll see the impact of COVID that will have in the future, the next 5 or 6 years. And we were particularly worried about travelling children not being in school. And some traveller children mightn't even have electricity out there, mightn't have a laptop, mightn't be getting their homework sent back from school. So this was a huge concern for us. And we did bring it up a number of times during COVID as well. But I think it is going to have a great impact on the young travellers still in the education system, how COVID is going to impact around their education as well. So we just see in the future what's going to happen. But there is kind of different supports within some of the schools as well. Maybe not enough of them are for travellers. We know the traveller visiting teacher, I know they were taken away in 2008 as well, and they were a great resource to travellers out there as well. So we've lost an awful lot since the recession in 2008, and like over the number of years, nothing has been put back in place. So I know there is an education strategy hopefully coming out within the next while back, and I suppose that might improve things then for travellers as well. But we do know government departments are very good at bringing out documents and policies, but very slow to really implement them as well. So I think that's something that we need to be pushing for as well.
Well, as our work on the ground, we'd probably we'd link in with people with education as well. So just say, for instance, said there a couple of months ago, there was Grandparents' Day, and say I attend one of the schools and my grandchild is there, but she's in the classroom and all the girls is up front and they're singing and I did give her heed, because with our work we'd try to recognise children falling back a little bit as well, and just asking them what can they read or what do they know, and she would be a little bit back as well. So when I went to the Grandparents' Day, I had a chat with the teacher and say that's like only a couple of months ago, and you can see the difference in that child already. So this is our work as well, out there advising the mothers. Make sure and keep having chats with your teachers or your principals if there's anything worrying, or the children is falling back or they don't like going to school. She's changed completely, and that's just talking to her teacher, and the teacher didn't take it as much to say, well, this granny is interested, or her mother, that I will. And it's unbelievable the difference in that child in that couple of months.
But also I think what's very important as well is the training that teachers does, is that there's a traveller piece of training within that as well. Because if you look at schools, and you look at how they give out their paperwork and stuff to the children, not everybody has a mommy and daddy. Some of them might have two daddies, two mommies. As Mary said, Grandparents' Day, like there was no Grandparents' Day when I was going to school. And I know when my daughter was in school and she was asked to do an exercise and how to make a cup of tea. And our cup of tea would be quite different to how the general population makes it. We would make it much differently. And I said, go back and I say how we make it. No, I would be embarrassed to say that. So it goes to show you, like Culture Day, celebrating children's culture. We've so many different children now. So I imagine we got this when we were much younger, that coming through the education system, I think we would have learned a lot more. We would have been more happier as well. And I think our education levels will be up that much more. But we didn't have them things to celebrate anybody's culture, to celebrate what they do differently to our culture. I think that's a way of getting people known of all the different cultures that we have within schools, and we can learn from each other as well. So when children come out of schools, that they're more prepared for life. And we certainly weren't prepared for life, and neither was the general population, because travellers at the time was only people in schools that was that for a different culture. But now we have so many different, and we could learn from them all. And as we get out of school, then we've been more familiar. When I look at, we have so many different people here, and they all do things in a much different way. So I think this is about learning from each other as well. I think that's very important around teachers being trained. And then more traveller teachers. We would like to see more teachers with travellers. We don't know, we have a couple of teachers out there that is from the travelling community, which is great to see. So I think we need to see more of that as well.
The advice that we'd give is for parents to help themselves and get interested as well, because they probably haven't learned. So we encourage them to put their children to school and keep them there, and also keep them links with schools.
Yeah. Okay, I said that was the last question, but one more. Is there anything NGOs, other organizations could do to help support and promote your work?
Yeah, we do get a lot of support from different people out there. So yeah, we've all very, I suppose the more that comes forward, the better for ourselves. But I think we do get a lot of support there. And as I said, a lot of people come looking for us to give them support as well. If they know travellers are not engaged in our, but also what we'll be looking for as well to be rolled out. And I know it's in within the education system, but it needs to be rolled out within health service as well, is the ethnic identifier. We need numbers. We know government department like numbers and they always go by numbers. And if you look at the census and the summary that was out there just 1 or 2 days ago, and they did say that people within the general population, we've an aging population and how to plan for them in the future. Where if there was an ethnic identifier within the maternal services, now we know some of them piloted and kind of have lost it for the last number of years, but we would be looking for an ethnic identifier. Even around COVID, it was only what the primary healthcare projects counted who tested positive. And we would have numbers, but we say probably there would be a lot more, but there was no ethnic identifier and probably came in too late within at that time. So if we had numbers, that's evidence, we have proof then, and then we can go on the numbers that we have. So that's one of the things we've always been battling for within Pavee Point as well, is for the ethnic identifier to be rolled out in lots of the service there. We do know some of them is used, but we would like to see a lot more out there using it. And for everybody to be asked it, not just travellers. Like the census question that everybody will be asked it when going in. And I think they need probably a bit of training around it as well, because sometimes staff members might have a little bit of fear of asking the question as well. So I think it's about training them. And then what we find is when there's a turnover of staff, the other staff member still would have that little bit of fear and the other person moved on. So to continue on within the services as well. So it is very important for numbers. Yeah.
And I think the thing I'd be mostly passionate about would be education. Say for my grandchildren in the future and for travellers go. So to me, the more help the children or people, especially when they start school, get and schools get help to help them, is the better. Because just as the story is, I always remember is I would have a lot of relations who live over in England and they live in Oxford. And there was a lot of them following our school. They were finishing the primary school, but they were going into secondary school and coming out. So as you know yourselves, like Oxford, it'd be a very educated part of England. So they'd be like, and they ended up then getting the teachers and getting everyone together and said we'd visit the sites and talk to the parents and the children, see why are they leaving school. So when they did, they found out why did nothing for there's no jobs. So what would you be interested in? So them little boys and girls would put straight away, even into apprenticeships. Just the word and accent, say like for special needs or anything, but it was a way of helping them for the future. Support. And when you look at them now and the support that they got, they're far away now. The world now is their oyster. So I would like to see something, say in Ireland or say where travellers is, just for that little bit more support and help.
Great. Well, thank you both so much for your presentation and for your patience answering all the questions. I think we all got an education today, and it's really important that I suppose we're aware of what people might be feeling when they come to us for all the different programs and supports, you know, and how they might have fear and barriers. And it's really important that people know just how difficult it can be someone to take that step and to walk through a door. So really appreciate, I think you'll be back if you're willing, because it's just been such a brilliant webinar. So I think we'll finish up there if that's okay. We're just at 10 past 12. Thanks everybody.
Okay, thanks everybody. Thank you.
Thanks a million.
Thanks very much. Bye now.